Hello and welcome back to my channel. Today we're talking about ulcerative colitis, a chronic inflammatory condition that affects the colon and rectum. This disease falls under the category of inflammatory bowel disease, or IBD, and it can have significant impact on a person's quality of life. Unlike Crohn's disease, which can affect any part of the digestive tract, ulcerative colitis is limited to the large intestine and typically involves continuous inflammation of the colon lining. If you or someone you know has been diagnosed with ulcerative colitis, understanding the condition is the first step toward managing it effectively. In this video, we'll discuss what causes ulcerative colitis, its symptoms, how it's diagnosed, and the different treatment options available. We'll also talk about lifestyle changes that can help keep symptoms under control and improve overall well-being. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Ulcerative colitis is an autoimmune condition, meaning the body's immune system mistakenly attacks its own tissues. In this case, the immune system targets the lining of the colon, leading to chronic inflammation and the formation of ulcers. These ulcers can cause pain, bleeding, and digestive issues, which can range from mild discomfort to severe complications. The exact cause of ulcerative colitis isn't fully understood, but researchers believe it's due to a combination of genetic, environmental, and immune system factors. People with a family history of ulcerative colitis are at higher risk, and certain environmental triggers such as infections, diet, or stress may contribute to flare-ups. However, ulcerative colitis is not caused by poor diet or stress alone, though these factors can make symptoms worse. Ulcerative colitis is a lifelong condition, but the severity of symptoms varies from person to person. The most common symptoms of ulcerative colitis include persistent diarrhea, often with blood or mucus, abdominal pain and cramping, an urgent need to use the bathroom, and unintended weight loss. Many people with ulcerative colitis also experience fatigue, fever, and a general feeling of being unwell. The severity of symptoms depends on how much of the colon is affected. If inflammation is limited to the rectum, the condition is called ulcerative proctitis, and symptoms may be mild. When the entire colon is involved, it's known as pancolitis, which tends to cause more severe symptoms, including significant weight loss and anemia due to blood loss. Flare-ups can be unpredictable, lasting for days or weeks before symptoms improve. During remission, symptoms may disappear entirely, but they can return unexpectedly. Over time, repeated inflammation can lead to complications such as an increased risk of colon cancer, severe dehydration, and in rare cases, toxic megacolon, a life-threatening condition where the colon rapidly expands and loses its ability to function. Since ulcerative colitis shares symptoms with other digestive disorders, including irritable bowel syndrome and Crohn's disease, proper diagnosis is essential for determining the right treatment approach. Diagnosing ulcerative colitis begins with a thorough medical history and physical examination. A doctor will ask about symptoms, their frequency, and whether there is a family history of inflammatory bowel disease. Since other conditions, such as infections or food intolerances, can cause similar symptoms, additional testing is often needed to confirm the diagnosis. A key diagnostic test for ulcerative colitis is a colonoscopy. This procedure involves inserting a thin, flexible tube with a camera into the colon to examine the lining for inflammation, ulcers, and other signs of disease. During the procedure, small tissue samples called biopsies may be taken for further analysis under a microscope. A sigmoidoscopy, which is similar to a colonoscopy but focuses only on the lower part of the colon, may also be performed in some cases. Blood tests can help identify anemia, which can occur due to chronic blood loss, and check for markers of inflammation, such as elevated C-reactive protein or an increased erythrocyte sedimentation rate, or CRP and ESR. Stool tests may be used to rule out infections or detect calprotectin, a protein that indicates inflammation in the intestines. In some cases, imaging studies such as CT scans or MRIs may be used to assess the extent of inflammation and rule out complications. Once ulcerative colitis is confirmed, treatment focuses on controlling symptoms, reducing inflammation, and maintaining long-term remission. The treatment of ulcerative colitis depends on the severity of the disease and how well a person responds to different therapies. The goal is to reduce inflammation, manage symptoms, and prevent complications. Treatment options include medications, lifestyle modifications, and in some cases, surgery. Medications play a central role in managing ulcerative colitis. The first-line treatment for mild to moderate cases is aminosalicylates, such as mesalamine, sulfasalazine, and balasalazide. These drugs help reduce inflammation in the colon and are often used for long-term maintenance therapy. They can be taken orally or as a rectal suppository or enema, depending on the location of the disease. For people with more severe symptoms or those who do not respond to aminosalicylates, corticosteroids such as prednisone or budesonide may be prescribed. These medications work quickly to suppress inflammation but are not suitable for long-term use due to potential side effects like weight gain, osteoporosis, and increased risk of infections. If symptoms persist despite initial treatments, immunosuppressive medications such as azathioprine or 6-mercaptopurine may be used to weaken the overactive immune response. These drugs can help maintain remission but require regular monitoring due to potential side effects like lowered blood cell counts and liver toxicity. Biologic therapies, including tumor necrosis factor or TNF inhibitors, such as infliximab and adalimumab, have revolutionized ulcerative colitis treatment. These medications target specific parts of the immune system to reduce inflammation and are often used in moderate to severe cases. Other biologic drugs, such as vedolizumab and ustekinumab, target different inflammatory pathways and may be considered if TNF inhibitors are not effective. A newer class of medications, called Janus kinase inhibitors, such as tofacitinib, can also be used in severe cases when other treatments fail. These medications work by blocking specific enzymes involved in the immune response. I just wanted to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any topics you want covered in future videos. Anyway, surgery is an option for people with severe ulcerative colitis who do not respond to medications or develop complications like colon perforation or cancer. The most common surgical procedure is a proctocolectomy with ileal pouch anal anastomosis, also known as J-pouch surgery. This involves removing the colon and rectum while creating a new pouch from the small intestine to function as a replacement for the rectum. In some cases, a permanent ileostomy, where waste is collected in an external bag, may be necessary. Beyond medications and surgery, lifestyle modifications can help manage symptoms. Eating a balanced diet, staying hydrated, and avoiding trigger foods such as dairy, spicy foods, and high-fiber items during flare-ups can reduce discomfort. Keeping a food diary may help identify specific triggers. Managing stress is also crucial, as stress can worsen symptoms. Techniques such as meditation, deep breathing exercises, and physical activity can help reduce stress levels. Regular checkups with a gastroenterologist are essential for monitoring disease progression and adjusting treatment as needed. Ulcerative colitis is a chronic inflammatory disease that affects the colon and rectum, causing symptoms such as diarrhea, abdominal pain, and fatigue. While there is no cure, effective treatments can help control symptoms and improve quality of life. Medications including aminosalicylates, corticosteroids, immunosuppressants, and biologics are key to managing inflammation. In severe cases, surgery may be necessary. If you have ulcerative colitis, working closely with your healthcare team and making lifestyle adjustments can help you maintain long-term remission and prevent complications. Thank you for watching. As always, take care of yourself and make the most of your day.